The production of this program is made possible thanks to the support of the following and viewers like you. We have a once-in-a-lifetime opportunity to create Canada's premier centre for excellence in mental health and addictions in BC's Northeast, says Mukhtar Latif of Pomegranate Housing Consultancy. The Northwind Wellness Centre Society and Treaty 8 First Nations have put forward a plan to repurpose the Site C workers' camp, transforming it into a permanent asset that will deliver transformational healthcare services. The worker accommodation facility was built to house 1,600 workers, and it came with a wide range of services and utilities. Now that the work of building the dam is complete, the workforce accommodation facility is about to be decommissioned. This facility, if repurposed, will address a more than 6-month waiting list for people needing treatment in northern BC, says Latif. To succeed, BC Hydro must endorse the plan to repurpose the site, a plan that Latif says has multidimensional benefits. The centre will generate new treatments and best practices, train more than 200 people in critical healthcare roles, and save the healthcare system more than $30 million. I invited Mukhtar Latif to join me for a conversation that matters about the innovative plan to reuse the Site C Workcamp as a place of healing. Mukhtar, welcome.
Thank you, Stuart. Hello.
It is innovative thinking. Where did the idea come from?
It came from the work that we've been currently doing with the Northwind Wellness Centre Society. We're building a new integrated facility over in Pomegranate. Northwind have been providing addiction treatment in the region for quite some time, over 30 years, and they were finding that there was such a huge need in the north that they wanted to expand that facility. So for the past 5 years, we've been working with a range of funders, including BC Housing, CMHC, First Nation Health, Northern Health, Street to Home. So there's been a lot of people coming to the table, and it was interesting as people came together what we could actually deliver in terms of an integrated holistic service for people, because what we were finding is that people were going to detox and then they were let go, and because there was nowhere for them to go for treatment, then they were going for treatment, and then they were going back to their communities with no ongoing continued support and care. So this facility will have detox, addiction treatment, recovery housing, and recovery community centre all in the one.
Well, let's talk a little bit about the lack of services in the north.
Right.
For people dealing with mental health challenges and also addiction challenges. There's very few centres where they can go and get comprehensive care.
I don't think that the facility that we're building is first of its kind in Canada. Is something that was
the one that's currently
that's been built.
Yeah.
A lot of the other services tend to be sort of individual services and programs that people have to go to. So this will be the first integrated service. There is obviously a real challenge in terms of having resources in the north, and that means a lot of people having to travel over 500 kilometres to get to services, which is a real challenge for people.
Well, and a lot of these people may not have easy access to transportation either.
That's right. Yeah, it's very difficult up north.
So you're building this one facility in Pomegranate, right, or Pomegranate at the moment. Where did the genesis of the idea of saying, you know what, we can repurpose the work site facility at Site C and turn it into a leading center of excellence?
I think this comes from the fact that we're seeing such a huge challenge across BC. The number of deaths from overdoses is the highest in Canada in terms of a province. And then in terms of the impact that it has in the north, that is obviously disproportionately higher, and especially impacts on Indigenous communities as well. And we've seen that there's rising homelessness, there's addiction, people who are mentally ill and addicted are right across every community in the province, and there is no overall plan of how we're going to address this. So looking at examples from other parts of the world, we saw that there's an opportunity here to create something that was going to allow us to actually understand what these programs do, how they could be assessed, how we could do some research and share best practice so that we can measure outcomes, as opposed to individual programs where people really don't know what the outcomes are, and there's a lot of money going into those programs at the moment. So that was the genesis of the thought, and then we thought, okay, well, we got accommodation here that could be provided for health workers because there's a shortage of health workers in the community, and then part of the work that we're doing for Cooper is also vocational training for the participants as they go through. So that then generated the thought, well, then why don't we have training for healthcare professionals, because we know that there's a growing need across the province as we grow the programs. There's not enough workers now with the right skill sets to be able to help people for those mental health and addiction. So if you put it all together, you've got this great big facility that's there, ready to be developed, and well, not even developed, is there. The money's been spent. It's grade A facility. It's been well maintained, and BC Hydro are looking to decommission, which basically means that if they can sell some of the units, pieces of modular construction, they will do. Otherwise, the rest of it will go to waste. Literally, it'll go to the landfill.
Which would be a waste.
Totally, yeah. I mean, you're talking about over 320,000 square foot of material that will be will be filling up a landfill in the regional district, and obviously the regional district does not want that to happen either.
The production of this program is made possible thanks to the support of the following and viewers like you. I'm also fascinated by what you were saying about, you need to have the space to be able to accommodate the people who can deliver the services. And this site can help do that. And so how severe is the shortage of people who can deliver services within this area of healthcare?
I think there's just generally, I mean, if you look at the number of supported housing projects that we're building across BC, it's been a real challenge to recruit and retain staff. So having an opportunity, and especially in the north, what you find is that people come for a short period and then they move on, and that's not a way to have a service delivery for individuals in the community where people are coming and going. So having people that are trained up, that live in the north, and you then creating opportunities for local communities, including Indigenous communities that are in the north as well. So keeping the economic growth within that region strengthens them, and therefore allows them to have other opportunities to grow as a community.
Let's talk about the scale of this facility. As you said, it is massive. How many rooms, how many wings, what's it worth?
Okay, so in total, there's about 1,764 rooms. These are hotel rooms with a double bed and an ensuite. And then you've got a dining facility that will cater for up to 1,000 people. You've got gyms, you've got a track, you've got a medical center, a movie theater. So it's a village in its own right. And each of the wings, so there's about 20 wings of about 84 rooms. So it gives you the flexibility to have each wing being servicing for different needs. So we are looking at a way to be able to address this need over a period of time. So we understand that money's tight. The province is obviously looking at ways to be more efficient in the way it spends its money. So with this facility being in place, you are saving all the construction costs. That's $450 million. That's already been invested in that facility.
$450 million is what has been invested so far.
So far, yeah.
Wow.
Yeah.
Okay. So are you asking BC Hydro, I guess by extension the province, to give you the facility? Or is there a cost associated with what you're proposing?
The facility itself, yeah, we're asking for the facility to be transferred over. At the moment, it's a cost to BC Hydro to decommission the facility.
So they're going to pay to take it down no matter what.
Exactly. So for them to transfer this over to the Treaty 8 Tribal 8 Association, it will be part of the reconciliation that we've been working with, and it'd be a real way to have an Indigenous-led Centre for Mental Health and Addiction accommodation. So it will be transferred over to this society. And then what we're looking to do is rents the rooms to essential workers that would generate sufficient income to keep the lights on for the next 5 years.
Oh, okay. So you'd be creating the housing situation, but those workers would then pay rent.
Right.
Okay.
Yeah. For up to about 1,000 rooms, you could have workers. BC Hydro still need to have workers to reclaim the land that's around this and maintain the dam. So there's an ongoing need from BC Hydro. There's other industries that will be looking for accommodation, and there's healthcare workers as well that are looking for accommodation as well.
Oh, okay.
So we're looking at a sort of a phase plan because we understand it takes time for everybody to come to the table. We are working with universities and other partners to build up those partnerships. And then the idea will be to bring those partnerships in over the next 2 to 3 years as we develop the programs. As funding becomes available, we could be looking at repurposing existing funds so that we're not looking to create new money going into the facility. We're working to reach out to the federal government as well as Alberta and Yukon, because we also understand that everybody wants to mitigate their liability and risk. So we're looking at an overarching national centre that could really make a difference to a lot of people's lives.
So where are you at in this process?
Well, at this stage, we've had lots of conversations with the BC Hydro project team. We've written to the BC Hydro board asking for them to consider a change in the mandate, because the current mandate is to decommission and remove the asset from the site and reclaim the land.
Okay.
So we're asking for that to be changed so that we can keep the asset on site and have that conversation about how we can sustain it for the long term.
How are those conversations going?
They are moving along, but we understand that there's a bit of a time pressure because initially BC Hydro were due to decommission at the end of July. Now they've extended because their work isn't going to be complete till the end of September. We know August is a bit of a dead month, so we want to be able to get the approval to negotiate so that we can get the due diligence done so that everybody's aligned when that decommissioning is due to happen.
The production of this program is made possible thanks to the support of the following and viewers like you. So in your proposal, when do you start to see units? Because one of these things, they're ATCO trailers, basically, aren't they?
Well, no, they actually,
no.
Well, ATCO has built them, but they look like hotels. So yeah, no.
But they're modular.
They're modular, but they like modular. Yeah, it is like a proper hotel, and you wouldn't recognize them for being ATCO trailers. But
the decommissioning and moving of the facility is relatively easy, isn't it? Like in the sense that, of course, you need to have the equipment and the trucks and whatnot, but you pull out a unit, put it on a truck, and you can move it. So how quickly could you start to be able to realize this vision?
Well, we would just take the key because we're not looking to relocate. We're looking to stay on site.
Oh.
Yeah.
I didn't know that.
Right.
You just stayed right on site.
Yeah, one move. That costs you between $3 and $5 million to deconstruct and move elsewhere, and then you have to put the services in and then the facilities. We're looking to keep it on site.
Well, that's a fabulous plan.
Yeah, it's a great opportunity because there's opportunities for the participants to then work in the hospitality, the maintenance. ATCO have committed to work with us to support participants going through the program. BC Hydro are reclaiming the land, so there's opportunities for working in the land for the participants going through the programs that we will be looking to develop. But yeah, no, it's the greatest value to keep as is, because even if I relocated some of them, a fair chunk of the site will have to stay as is, because the way it's been constructed is you can't really easily relocate that.
Right, you're just down off the bluff there above the dam.
Right.
Yeah, and it's minutes away from Fort St. John.
Yeah, it's like a 5-minute drive, if that.
Okay, this plan is looking even better. In reading through it, I was trying to figure out, okay, where do you want to move this to, and what's the? This is an even better plan.
Oh yeah, no, totally. I mean, if we were to construct a facility like that, you can imagine you would have to go and raise $450 million. You would then have to get planning. You would then have to get a contractor and build it. That's like 5-10 years down the road.
Probably 10.
If you're lucky.
Yeah.
Here, you can have that immediately available to meet those needs right now.
Isn't that remarkable? Okay, let's start talking about what some of the elements are of this Center of Excellence in the delivery of healthcare. What's the first and most important need that needs to be filled?
The first, I think the way we would be looking to do it is looking at the healthcare trainers, because I think the biggest challenge that we have is resources and having enough staff to be able to provide the services that we want to deliver to the participants that will be going through the programs. We've already got the facility at Poughkeepsie that will start operating next year. So that will then have people going through detox, addiction treatment, recovery housing. But obviously, once they get into the recovery housing and go into the programs, there's opportunities then for them to move into the supported housing that we could potentially have in this facility. So depending on what funds are available in terms of programs, we could start with people that are fairly well advanced in their healing journey and could go into jobs and training. So I think the vocational training for healthcare professionals and participants that have gone through supported housing programs and the addiction treatment programs will be the first step, alongside finding ways that we could generate revenues for the essential workers in the communities.
And that facility would allow you to provide that training right there,
right? Because
you can just repurpose some of those rooms into classrooms.
Well, there's already meeting rooms and classrooms, and everything's there. Yeah, you wouldn't need to do anything.
Wow. Okay, so as you say, you need to have this continuity of care. Somebody goes through detox, they then need to have that next step. Let's talk about just how vitally important in somebody's recovery journey that is.
Yeah, and that's been an interesting discussion with the funders. So we've had Northern Health that are funding the detox at this property in Poughkeepsie. We've got First Nation Health that are funding the addiction treatment. We've got BC Housing that are funding the supported housing. And Northern Health are also, through the government, are funding the Recovery Community Centre, the Junction. What we found is that there's a certain period that people go through detox, medical detox, which is what Northern Health is responsible for. But as we were mapping out the process of how people would flow through their facility, there's a gap between the people going through detox and being ready for treatment, because people going to treatment have to commit to the treatment plan and be ready for that. Once you just come off detox, you're not in really a place where you might not be in the place to be able to make those decisions. So there's a pre-treatment gap that we identified through this exercise, because we were seeing all of the services all in under the one roof. So now we're working with First Nation Health Authority about how we have a pre-treatment process where people are given the space where they can stabilise, have counselling, have an elder guide them, and then they can decide whether they want to go into treatment. Before that, they may not be ready to go into treatment, be told to go into treatment, and therefore not do as well as if they were ready for that process.
So the likelihood of them being able to successfully navigate that journey of recovery diminishes greatly.
Exactly. So from that perspective, what we've seen is that by having that integrated facility, you actually seen where the gaps in service are and how you can actually work on the basis of what the participant needs rather than what the services deliver. And that goes through to the programming for the supported housing, which is really there for shelter and food, but not really vocational training. And there's something that Northwind are working on with BC Housing about how we can have training for people to then be able to be resilient, and when they go back into the community, they've got purpose and be able to hopefully stay away from addiction the best they can.
Right, and how long are those treatment programs? Once they move into treatment, how long would they then be, cared for through this facility? Yeah,
so the detox period program is between 5 and 7 days, and then you have a 90-day treatment program. And like I said, we're trying to put the pre-treatment in as well. And people can stay up to 2 years in the supported housing. And then you've got the community centre, which people can then drop in and have peer reviews. So you can see how quickly you can fill that space up, and that's why we felt that there was a need to expand that and having some facility like the accommodation at Site C would be an opportunity not to be missed.
The production of this program is made possible thanks to the support of the following and viewers like you. One of the other elements of your proposal is to develop a center of excellence in treatment for mental health issues. And we do know that there, unfortunately, there is a connection, not 100%, but significant connection between mental health issues that aren't being attended to, leading to substance abuse. So what will this center do then to be able to provide services that will help people manage their own mental health challenges?
Yeah, I mean, part of the work that we're looking to do is with universities, researchers and others that will be looking at programs that can help support people with mental health. We will develop people, social workers and counsellors and others that can help support people through that process too. The site is big enough. I mean, we obviously want to know how we can manage the facility in an integrated way, but the site is big enough to have additional add-on modules that can come in, so you could have different wings that could be self-contained to meet different needs, including people with maybe even severe mental health. But you've got the core facility that will provide operational efficiency, like the cooking and the dining rooms, and all the foods and services could be provided, as opposed to one-offs which are very expensive to operate on an ongoing basis.
So most important is that BC Hydro signs off and says, okay, it can stay there, here it is, we're going to transfer ownership. What are the other components that you need to make this a success?
We're looking to find partners out there that want to come and work with us in a collaborative way to develop the consortium, because we want to make sure that we're providing best in service in terms of the opportunities out there. So we're looking for partners. That's colleges that can provide vocational training, that's universities that do research into mental health and addictions. We want to be able to share the best practice across the province, across the nation, globally. I mean, there are centres of excellence globally that people then come and see how things are doing, so they can go and replicate back in their own countries. And rather than us going to them, it'll be a great opportunity for Canada to be at the forefront of that.
Do you need money?
We need some money.
How much?
Not that much. We don't need $450 million, that's for sure.
That's a big bonus.
That's a great bonus. I mean, there's going to be some pre-development work. We have to get the zoning. We've got to get some adaptations, but it's in a few $1 million, I would have thought, because we have to get the zonings, we've got to get the surveys and get the things set up. But we're hoping to look to generate revenues to run the operations on a day-to-day basis, and we're looking at roughly about over 50% of that coming from the rental income that we can generate, and then we'll be looking at ways that we can access existing programs for training.
So existing government programs?
Exactly. Yeah.
Wow. So we're coming down to a deadline.
We are.
Next steps for you?
Our next steps is to get the message out there. I mean, I think part of the challenge that we found is that people just are not aware of the facility. And because it's cross-sectoral, it's health, it's education, it's housing, it's jobs, it's training, it's very hard to get one person who's responsible for all of those things to actually say, yeah, we got the time and the energy to be able to make this happen.
So where can people go to find out more information and give you support?
Oh, okay. The best way to approach is the North Wind Wellness Centre website. They're the ones that are coordinating all this. Isaac Hernandez is the ED. It'd be the North Wind Wellness Centre Society.
Well, I wish you great success. I think it's innovative thinking, the kind of thinking that can change people's lives.
I think so, yeah. I mean, it's just a real opportunity, and we just see that it will make a great difference to people's lives, that in a much broader sense than just health. I mean, you've got jobs, you've got economic opportunities. So yeah, it was looking forward to finding ways to make this happen.
Great, thank you.